The key benefits are several. One, it's useful to have a plan in place of what you need to accomplish as an organization. Once you've got the plan in place, it's necessary to prioritize that plan and design your platform with an eye for reuse. It's critically important to build your adapters to those backends in a way that they can be reused for the multiple stakeholders we've talked about, whether it's clinicians, patients, administrators, people who are maintaining the facility, or specialty groups like diabetics. There's a marvelous example in Toronto, Canada, with Trillium Healthcare, where they've reused this kind of information to help their diabetic population manage themselves better, report on their results, collaborate with other diabetics, be in contact with their case manager. Because again, the objective at the end of the day for that community is to stay well, stay out of hospital, and improve their quality of life. So those are some of the things that are necessary. Organizations can learn about portal use a variety of ways. There are a number of well-documented case studies in the industry now. IDC, Gartner, and customers themselves have shared their stories and their experiences, and many of them have documented the benefits. It's also important to come together as groups of organizations to share content, share portlets. We have that happening in Canada, for example, where multiple hospitals are coming together and sharing portlets. And in fact, there's a marvelous example in the Ontario province where the Ontario province is providing a lab portlet that is being reused by multiple institutions. So it's about doing your homework, it's about sharing, and it's about passing along what you've learned at the prior stages to your colleagues. The key thing I would tell a hospital is to keep in mind two things. One, to take an enterprise point of view about the platform. That the value of a portal comes from the ability to reuse what you develop in one stage in another stage. The other key message is to engage the stakeholders, whether they're the administrators or the clinicians or the patients in that development process. Because as George pointed out, it's not necessarily about the technology. It's about how it's being used by the people at the end of the day.
And don't eat more than you can lift.
And don't eat more than you can lift. At the end of the day, pick small problems, work those to completion, deploy them, see how it's received, refine it if it's necessary, and then move on to the next one. Build on your prior successes moving forward. So it's about picking a platform for reuse, it's about engaging the people who need it, and it's about doing it in an incremental, iterative fashion.
We've been talking a lot about integration, and if you really think about it, what we've been talking about is garnering value from existing infrastructure. IBM does not have a view that we need to rip and replace your legacy investments. What we're doing is taking all the investments you have up to now and getting more value out of it. And that's the important aspect of what we've been talking about. Take your clinical systems that have been there for years and optimizing that. Take the data that's in your system, in your transactional systems, extract the value from that by using the technology that we've developed at that part of the health integration framework. We don't want you to throw anything away. We want you to take these technologies and applications that you have within your enterprise and leverage what we're bringing to the market within our frameworks.